Sunday night, Alperen Sengun comes down hard on his right leg and is eventually taken off of the court in a wheelchair. Welcome back, everyone. My name is Dr. Stefan Wilson, and the purpose of this channel is to help explain the mechanism of sports injuries. So on the replay here, there isn't much time left in the game and the Rockets are leading at this point. The Kings get a steal and go down the court where the Kings player is fouled underneath the basket. And then Sengun goes down hard and he stays down. Here we can see him immediately clutching his right knee in what looks to be a lot of pain. Here we can see him using his left hand and his left thumb, and he's pushing into what we can believe to be a painful area of his leg. So he is touching the more inside or medial part of his thigh and his knee. We can observe his facial expression, and that makes me uncomfortable about how much pain he is in right now. There are a number of different angles that they show, and on the replay here, one of the best angles to piece together this puzzle is it's right about here. When we stop the replay here, we can see how all of his body weight is going down through his right leg. His left foot is off of the floor here. With this view, we can appreciate the compressive load that is being placed upon his right knee. His right knee is also in a fully straightened or extended position here with a little bit of outward force, so his knee is moving to the outside, and that can stress the outside knee ligament known as his LCL or his lateral collateral ligament. Well, his knee is actually going beyond a normal range of motion into extension, into what is a bit of hyperextension that it looks like. We'll move the frame forward a touch here, and now we can really see how both of his right foot and his right hip are more forward or anterior compared to his right knee. This is only going to accentuate the compressive load down on the internal structures of his knee. Those internal structures that I'm referring to are mainly his PCL, his posterior cruciate ligament, his ACL, his anterior cruciate ligament, and his medial meniscus, as it will bear the compressive load while the outside of his knee is likely to be stretched. Together, these inside structures are typically known as the unhappy or the terrible triad, because when their structural integrity is compromised, the road to recovery can be significant if there is a tear. At the very least, he does have a sprain to one of those ligaments and an irritation to his meniscus. Considering how much compressive force he sustained, a bone bruise of his tibia or femur is certainly a real possibility as well. With the continuation of the play here, it does appear that his right ankle did seem to twist and roll as he was landing as well. But with the replay, he is mainly clutching his right knee. So we can add to this the possibility of also a right ankle inversion sprain, and hopefully not a fracture. Here we can see the medical personnel for the Rockets. They are checking his right knee. We can get a glimpse of them performing of what is called a posterior drawer test, which challenges the posterior cruciate ligament. Also in this position, if there was a full tear of his PCL, often we can visualize what is called a posterior sag sign. This is where the tibia or shin bone moves backwards in relation to the thigh bone or femur. Now, I didn't get a great look at it here, so it is difficult to say with certainty one way or another if it was present or not. But then they bring out the wheelchair. They continue their preliminary evaluation on the floor, and then they help him up into the wheelchair. Here we can see he does not place any weight onto his right leg. They also lift up his right leg here to adjust the stirrups on the wheelchair. They lift his leg by grasping onto the lower part of his shin and lifting up, and then he is wheeled off of the court. Let's now turn to the anatomy screen where we will look at an image of a right knee. So at the top here, this long bone is your thigh bone, your femur, and the long bone below your knee is your tibia with the long fibula right beside it. In between your femur and tibia is your actual knee joint, which is separated by the soft cartilage of your meniscus. I mentioned earlier that with the amount of compressive load straight down and slightly backwards and to the outside onto his knee, this will stress certain structures. His posterior cruciate ligament right here, his anterior cruciate ligament right here, his lateral collateral ligament right here, and the meniscus that separates the thigh and shin bone. These structures are in harm's way with the landing that Sengun had. It's just a matter of getting diagnostic imaging done to help confirm his diagnosis. Hopefully he can and will return soon. Thanks for watching as always. Have a great night.